Hey guys, it's Sarah here. In this video, I'm going to be going over a health history for nurse practitioner students. So health histories are extremely important because they help to identify who's at risk to get certain diseases, and that will help you to identify, first of all, your screenings that you have to do. It'll also help you identify what disorder they have, what disease, and how to treat it properly. So let's get started. Number one, I'm just going to be going over the components of a health history, and then we're going to go into detail. So the first component of a health history is your introduction, then we go to past medical history, then we go to family history, then we go to social history, then we go to the review of systems. So that's pretty much the whole health history. After you do someone's health history, then you go on to their physical exam on them. But that will be a separate video, the physical exam. So now we're just going to be going over the health history. So like I said, first we start off with the introduction. So you're going to introduce yourself, tell them what you're doing here, what your role is, and that's pretty much it. So you're going to say, hi, my name is Sarah. I'm a student nurse practitioner, and I'm here to take your physical, I'm here to do a well exam on you. And of course, you're going to wash your hands. Now, the reason you want to wash your hands in front of the patient is because even if you did it a minute before outside, they have no idea. So if you're going to touch them, they're going to feel uncomfortable. Just wash your hands in front of them, make them feel better, and be clean. Then you're going to ask them who they are. So what's your name? What's your date of birth? And then you're going to ask them why they're here. So what brings you here today? And they're going to tell you either I'm here for a physical or I'm here for back pain. And then you're going to go into your HPI. So your HPI is your history of physical illness. So you're trying to figure out like everything about whatever they're telling you they're here for. So you're going to use a mnemonics old card. Old card is onset, when did it start, location, where is it located, where exactly is the pain, duration, how long have you had it for, and then you go on to carts. So carts is characteristics, describe it, is it sharp, is it stabbing, aggregation, does anything make it worse, does anything make it better, radiation, does it radiate to the back, does it radiate to the shoulder, does it radiate anywhere, and treatment, have you tried anything for it, did you self-medicate yourself, etc. So that's your HPI, your old cards. Onset, location, duration, characteristics, aggregation, radiation, treatment. And then you're done your first section. Like I said, the introduction. So that's pretty simple. Then we go on to your past medical history. So these are all components that you have to ask them. In real life, you might not be asking all this, but this is a nurse practitioner school, so you're going to be going through all this. And in real life, the reason why you're not going to be asking such detail is because there's no way you could spend an hour and a half with each patient. So in your past medical history, you're asking the patient any past medical history. If they say yes, you're saying when were you diagnosed, and that. Then you're going to ask them any chronic illnesses. If they say yes, you say when, what is it, and how was it treated? Like, are you being followed by rheumatologists? Are you being followed by oncologists, etc.? Then you're going to ask them any psychiatric illnesses. And if they say yes, you're going to say when were you diagnosed, when were you treated, and were you ever hospitalized for it? You're going to ask them any infectious diseases, TB, etc. Any allergies, any surgeries. If they say yes, you want to know what type, even if they had any complications. Any injuries or previous hospitalizations, and you're going to ask them, are their immunizations up to date? And then you're going to ask them about their sexual history. So like, don't say it like that, but you could say any past STIs, any past STDs, and how many partners do you have, or something like that. And you could say, and you could tell them first, I asked this for everybody. This is not specific to you. It's just part of our exam. Then you go on and you go to your family history. So this is part 3, family history. So for school purposes, they want to know about your children, your siblings, your parents, and your grandparents. And they want to know all the stuff I'm about to list. But for your regular practice, you're not going to be asking, is your grandmother, da-da-da-da, is your grandfather, da-da-da, is your sibling, da-da-da. For regular practice, you're just going to be any significant family history, and by significant, you mean like cardiac, diabetes, kidney disease. You don't care if they have mono or anything like that. So over here, for school purposes, you're going to be asking them the age and the overall health of them. And if they died, you're going to be asking them the cause of death. So for instance, let's say you say your grandmother, how old is she? Your mother's mother, how old is she? Say they give age. Is she alive? If they say no, what was her cause of death? If they say yes, you're going to say any past medical, like any history for, and you're going to ask the following: any HENT, cardiovascular, neuro, pulmonology, GI, GU, endocrine, musculoskeletal, obesity, cancer, bleeding disorders, mental and emotional, genetic disorders, substance abuse, and allergies. So what the school wants is you to ask all those for every single person. So the grandparents, the parents, the children, the siblings. And what people do is that if you're doing this in front of your teacher, you can just believe you have no siblings, no children, because to go through each one, you're going to be there forever. So that's what a lot of people do. Anyways, that goes through your family history. You're going to ask for each one, for your family, for your mother, for your father, for your maternal grandmother, like that. Then you go on to your social history. So for your social history, you're going to ask them where were they born, their nationality, marital status, are they married, any significant other, occupation, what do you do for a living, military status. You're going to ask them the living arrangement. So do you rent, do you own a house, where do you live? And you're going to ask them their habits. So by their habits, I mean, do they use laxatives, caffeine, what their diet is like, if there are any restrictions, for instance, are they vegan, do they exercise daily? Then you're going to ask them, do they use any tobacco, alcohol, and drugs? You're going to ask them about their emotional, so like what their sleeping's like, or stress, any stressors in life. Ask them what their hobbies are, and alternative health practice. Also, you want to ask them about safety, so gun safety, do they feel safe at home, etc. So that is your social history. Then you go on to the last part before the physical assessment, which is the review of systems. So the review of systems, you have to go through each system, and there's a whole bunch of stuff you could ask. There's no right and wrong, but you just have to go through a few ones in each system. So for example, if I'm asking for eye, it's not like you have to ask, is there any drainage in your eye? But you could ask something else. You could ask, do you have trouble seeing, any blurry vision? You could pick your own thing under each system, but it has to just be a few of them that covers a lot. So I'm just going to say a few. You don't have to pick these ones, but that's it. So first you're going to ask them general, your overall health. So any fever, chills, weight loss, fatigue. And this is you asking them. So you're not going to tell them, no, you don't have a fever. This is them telling you what they think. So fever, chills, weight loss, and fatigue. Then you're going to go into their eyes. You're going to say any change in vision, any blurry vision. Do you see anything floating or curtains in your vision? And when was their last eye exam? Then you're going to go on to the ears, nose, and throat, and mouth. Ask them any difficulty hearing, any discharge from the ear, or ear pain on one side. Nose, any difficulty smelling, runny nose. Mouth, any sore throat, problem swallowing, sores in their mouth, and when was their last dental exam? Then you're going to go on to their heart. Any chest pain, palpitations, fluttering, shortness of breath when moving. Then you're going to go on to the respiratory system. Any difficulty breathing, which is shortness of breath, cough, etc. Then you're going to go on to the stomach. You're going to ask them about the daily bowel movements. Are they constipated? Do they have diarrhea? Any blood in the stool? Then you're going to go on to GU. Any difficulty or painful urination, discharge. Then you're going to go on to musculoskeletal system. Any painful joints or muscles, any problems moving, so with range of motion. Then you're going to go on to their skin. You're going to ask them any changes in their skin. Is their skin very dry? Any rashes they notice? Lesions, nodules, etc. Then you're going to go on to the neuro. Any dizziness, blurred vision, unsteady gait, one-sided weakness, seizures. Then you're going to go on to psychiatric. You're going to ask them any depression, anxiety, bipolar, schizophrenia, like that. Then you're going to go on to endocrine system. You're going to ask them, are they hot or cold, excessive sweat, hair loss, weight gain. Then you're going to ask them about the hematology and lymphatic system. So do they bleed easily? Any prolonged bleeding? Does it take them a long time to get healed? Do they feel like they're constantly being sick? And last but not least, you're going to ask them if they're allergic to any food or anything, environmental steps. So that's pretty much it for your whole health history. The next part of it is you're going to go into the physical examination, which we're not going to discuss here because it's going to make this video too long. So that will be a different video, and if you want that video, please write in the comment section below, like and subscribe, and that's pretty much it.